Medi-cal or Medicare or an insurance company, which is really good for you because I'm going to give you unbiased information and I'm not going to try to sell you anything and I'm not going to sign you up for a health plan after this. So what I do is I work for the Lancaster Adult Day Healthcare, and dealing with insurances is something I do every day. I usually talk to them, but I never actually talked about them. So this is going to be my first time talking about them, so bear with me because there might be some questions and answers out there that I might not know. But give me time because I will find out and I will get back to you. Okay? So with that being said, Medicare is such a complicated topic and there's so much information out there and it's so broad. Medicare, the rules, the laws, regulations are always changing. So it can become very overwhelming for a lot of seniors out there. So let me see what I'm working with. By a show of hands, who here is Medi-Medi?
Who knows what Medi-Medi is?
That's my next question. Yeah. My second question, who knows what Medi-Medi is? And I guess only 2 people. All right, well, good. Then you guys can learn a lot today. All right, so I'm going to start by talking about Medi-cal first and Medicare. So Medi-cal, I'm going to try to give you the basics on what I think is most important for you to know. So Medi-cal, what is it and how do you get it? So Medi-cal is basically free or low-cost health care insurance for the elderly, the disabled, and for families and for children up to 21 years old. Now, there is something called share of cost Medi-cal, which also it depends on your monthly income. So, for example, a family of size of 1 that makes $600 a month or less, that person would qualify for free Medi-cal. Now, a family size of 2 that makes $934, these are actual numbers from the website, that makes $934, they'll qualify for Medi-cal. However, it would be share of cost Medi-cal. So this is where it gets tricky. What that means is that Medi-cal gives you an amount per month. So let's say this person share of cost is $800. So during that month, they have to pay up to $800 of medical services, whether it be your prescription, whatever you have to pay, up to $800. Now, once you hit the $800, then anything after that you spend on medical services, that's when Medi-cal kicks in and they'll pay for you. But you have to pay from your pocket all that time, all the money, until you hit your share of cost. Does that make sense? Yes. Okay, now, besides the Medi-cal, now there's all these health plans out there that depends on where you live and by zip code. The 2 main ones for LA County are Health Net and LA Care. Now everything else like Anthem Blue Cross, Kaiser, Care First, LA Care, they all are plan partners and they fall under LA Care. So Molina Healthcare, that's a plan partner of Health Net, so they fall under Health Net. So for example, if you wanted to enroll with Kaiser, let's say, as a health plan, you wanted to enroll your Medi-cal with Kaiser, you will first enroll with LA Care, and then Kaiser will give you like a permission slip, so you can enroll your Medi-cal with Kaiser through LA Care. I know, it becomes really confusing. Yeah. So the next question is, well, why would I want to get a health plan? Do I need one? Should I get one? Well, it's really up to you and what your preferences are and what you're looking to get out of this health plan. So for example, where I work at, the Lancaster Adult Day Healthcare, we take Medi-cal. We take straight Medi-cal and most of the HMOs out there. So if somebody, let's say you're interested, some of the services we offer are physical therapy, occupational therapy, individualized nursing care, we offer transportation, we offer a breakfast, lunch, and a snack, activities, and social services like one-on-one counseling and support groups. So let's say you're interested in physical therapy and you wanted to come to our daycare. I would contact Medi-cal first, see if you have straight Medi-cal and we can take you in and they'll pay for everything. And then they'll either say yes, go ahead and do it, or they'll tell me you have to sign up for managed care, or basically an HMO or a health plan. So that's when you get to decide what do you want to get out of this health plan. Do you want to come to daycare because of the PT and OT or whatever other service, or just for the social aspect of it? Then you sign up for either the plans that we take, which is we take SCAN, we take LA Care, Care First, Molina Healthcare, Health Net, and we also have a contract with the Veterans Administration. So that's just another ball game. So yeah, so whatever you're looking to get out of this plan, some of these plans have different programs and add it to the plan. So if that's, what you're interested in, then you should enroll in the plan. But you're also fine just having straight Medi-cal, because then anyone can see you and you don't have to be tied to a specific doctor or a clinic that you have to go to. Now, if you need more information about the health plans, or if you know a health plan that you want to enroll with and you're ready to enroll, I put the healthcare options phone number down so that you can contact them. It's the 1-800 number, and they'll help you enroll over the phone. And in addition, they'll give you information about the plans. So I got this little chart here from the Medi-cal website comparing different programs and services from the two main ones that I talked about for LA County, which is HealthNet and LA Care. So you can do your evaluation and decide what you need based on the services that you require or that you need. How do you apply? You can go to your nearest DPSS office, Department of Public Social Services, and there's one in Lancaster, it's Office 34. It's off of East Avenue K6. You can go in person, or if you're more efficient and you have internet access, you can download the application online. It is a PDF file though, so if you're gonna type in there, make sure you print it out, because it doesn't save. And make sure that if you're gonna send your application on the mail, that you get it a tracking number and maybe a signature, because we all know with big bureaucracies, paperwork tends to get misplaced. So that way you know for sure that your application made it there and you can track it. Alright? Alright, so that's about the health plans. Let's talk about Medicare now. Medicare is such a big subject. So basically there is traditional or original Medicare, and then there is Medicare supplemental plans, Medicare Advantage plans, and then we got your Part A, your Part B, your Part C, your Part D. Okay, so that's where it gets really confusing. So the basics, Medicare, it's health insurance for those 65 or older and under 65 with certain disabilities. Okay, like Lou Gehrig's disease and ESRD, I believe, the kidney disease. So how do you apply, how do you become eligible? Is it free? Well, traditional Medi-cal is the main one. Once you turn 65, or actually 3 months before you turn 65, they automatically send you your Medicare card with your Part A enrolled. They're enrolled in your Part A already, which is your hospital inpatient part. Now, is it free? Yes and no. You're entitled to your Part A if you have 40 work credits. What does that mean? So basically right now for 2014, if you make, for every $1,200 you make, you earn 1 credit. But the maximum number of credits you can earn in 1 year is 4, regardless of how much you make. So 4 times 10 equals 40. So you have to work at least 10 years to get your Part A Medicare, right? So you get that. Now, well, Karen, I was a stay-at-home mom. I never worked, or I don't think I have all the credits I need to have my Medicare Part A. It's okay. You can qualify and you can be eligible for your Part A through your deceased spouses or your divorced spouse's record. Yeah, they can make that easy. You take what's yours. Yeah. You can become eligible through that. And then that's your Part A. Your Part B, you can enroll into a Part B. So your Part B is the doctor visits, outpatient. So if you know you're going to be taking some trips to the doctor, it's a good idea to enroll in Part B section of that. And the open enrollment for that is between October 15th and December 7th for this year. So you might want to look into that. Okay, so we got traditional Medicare, right? Part A and Part B. Oh, about the work credits. You should be getting quarterly statements from your Social Security Administration with the statement saying how many credits you have. I know I started working when I was 16, and not too long after that I got my first statement. I was like, whoa, what is this? What is this? So you can look at your statement, and if you're not getting the statement, it's okay. I put the Social Security phone number there, so you can call them and ask them, questions. How many credits do I have, or what do I need? How can I qualify? Can I use my ex-spouse's record to qualify? And they'll give you a list what you need. And they're pretty available. They're available from 7 a.m. to 7 p.m. So you should be able to catch them there. You might have to wait a long time. Don't call in on Monday, because I've been on hold forever. Okay. So we got traditional Medicare, right, or original Medicare, Part A and Part B. Now it's where it starts to get complicated, which is Part C. They also like to call it the MA plans, or it's the Medicare Advantage plans, and then we have your supplemental Medicare plans. So when it comes to this, to make it not so confusing, I like to think of this as like a restaurant. So over here you got your Medicare supplemental plans, and over here your Medicare Advantage plans. So medical supplemental plan, I like to think of that like a buffet. You go in there, you pay up front, and then you eat whatever you want, and you take it because you already paid that one fee. So supplemental plans, cheapest I heard is about $120 a month. So keep in mind that with the supplemental medical plan, you have to pay a monthly premium. So let's say about $120. So whether you go to a doctor 1 time, 2 times, whatever you have to do, whatever lab work, whatever blood work, whatever, you don't pay anymore because you already paid that $120 or whatever it is, depends on where you live. You already pay that amount, so you don't have to pay again. Now with the Medicare Advantage plan, that you have to pay, let's say, $10 copay for every visit that you go to the doctor. So it really, what preferences, so if you want your mashed potatoes, your turkey, your gravy, you have $10, $10, $10. So if you're that type of person who doesn't mind digging into your pocket, writing a checkbook, or paying up front every time you go to the doctor, maybe a Medicare Advantage plan is good for you. But if you're like the other person that it's okay paying that amount and then just going, then a supplemental plan is good for you. You also gotta take into account what your income is. Like for example, my mom, she usually goes to the doctor like twice a year. She doesn't really go to the doctor. So if she had the Medicare supplemental plan, how much is she really paying for those 2 visits? About $1,400 a year. Especially if you're in an SSI of like $800–900 nowadays. Maybe Medicare supplemental plan is not right for you. So I say my mom should be in a Medicare Advantage plan because $1,400 for 2 doctor visits is better if she has $10 copay here, $10 copay there. Yeah. So like for my stepdad, for example, he likes to travel around the country, right? Medicare supplemental plans are good nationwide. So you don't have to belong to a network of doctors. So it doesn't matter what state he's in, he can go and be seen. It's more like a PPO. And then another thing for him is he goes to the doctor a lot. I heard this, that hurts, this hurts. He's always at the doctor. Yeah. So he forgets his checkbook, he forgets his wallet, whatever. So it's better for him to have a supplemental Medicare plan because he can just go be seen every time and he doesn't have to pay every time because you already pay that amount. Whereas a Medicare Advantage plan, you pay, and then you sign up for your Part D, your prescription coverage, which is around $30 nowadays. Anyway, so we got those 2 down, right? Yay! Okay, Part D is your drug prescription plan. Okay, or your drug prescription benefit. That one can get a little bit tricky. There's this thing called a donut hole that everyone's just like, oh, what is that? So the cheapest I've heard for a Part D Medicare, it's about $30 a month, right? And you can shop around and see what's best for you. And it is also by zip codes, like every other health plan out there. So basically what it is you pay your monthly premium, which is, let's say, is like your premium, which is like $30 a month. And then besides that, remember, you gotta pay your co-insurance, your co-payment, and your deductible. So $30, your deductible is about $310 a month. So you pay your deductible. So whenever you go get prescription, if you know you're gonna be using a lot of prescription, because I don't have to tell you, you guys know prescription can get really expensive fast. So I recommend that you sign up for a Plan D, Part D plan. Also, because if you don't sign up, they'll give you a 7-month period, and that 7-month period to sign up starts 3 months before you turn 65. So within that 7-month period, you have to sign up. And if you don't sign up, you will have a penalty, and they will charge it, and it will keep accruing every month. So it's better just to select something and sign up. Anyway, so basically the $310 deductible, you start paying. That's like right off your pocket, right off the bat, right away. Every time you go get prescription, you pay. Every time you pay, you pay it until you hit that $310 deductible. After you hit that $310 deductible, Medicare will pay 25% of your prescription until you hit $2,830. So Medicare, you'll pay 25%, Medicare will pay 75%. Now here's where it gets tricky, and it's that donut hole. When you hit between that gap between $2,830 to $4,550, that's the donut hole where you got no coverage. That's scary because you got zero, now that's zilch. You got no coverage in that area. Now so you pay everything from your pocket. Now after you get after the 40 between that period and after you get your $4,550 and over, then that's where you have coverage again. And they like to call it the catastrophic zone because now you met all that you needed and now you got coverage again. Does that make sense? I'm making it a little confusing. So I put some of different examples of monthly costs for different Plan B programs that are around our zip code in the area for Antelope Valley, for Lancaster and Palmdale at the bottom. Another thing to keep in mind is some of the experiences that I had at the daycare with some of the seniors that I helped is that there's all these health plans out there and they just come and sign up seniors for whatever, just tell them sign here, sign there, without explaining what they are. And then they get into this Medicare Advantage plan and they don't even like it and they can't even see a doctor. Like the last experience I had was a senior who had his podiatrist, his doctor, and his optometrist for like 10 years. And they had a really close relationship and he really liked his doctors. But somebody came along and signed him up for a Medicare Advantage plan without even knowing. They just told him, you get free hearing aids, you get a test, you get vision plan, you get dental plan, all excited about all these great things. So they signed him up, and then he went to his doctor's appointment. They turned him back when he showed his Medicare because he didn't have original or traditional Medicare anymore because he was signed up with the Medicare Advantage plan. So keep in mind that if you sign up with the Medicare Advantage plan, then you have to go to those specific doctors. That's why it's called managed care. You no longer have the freedom to choose what you want because these are programs that are provided by private companies. So the federal government gives these programs a specific amount of money a month to provide you for care and services. So they are in charge of your care. They're called managed care. So they'll decide whether you need that chemotherapy or whether you need XYZ services. So you gotta make sure that you know what you're getting into when you sign up for this plan because you might not be able to see your doctor that you were always seeing. So then this particular individual, he was really confused and overwhelmed because he couldn't see his podiatrist, he couldn't see his optometrist, he couldn't see his doctor because they signed him up for the Medicare Advantage plan. So what we have to do is we have to go through all this loopholes, calling, and they had to send him an application to disenroll. You have to wait another month. Meanwhile, he can't see his doctors. So you got to make sure that the doctors you're going to be seeing when you enroll for that Medicare Advantage plans are in the network and that you know who those doctors are going to be that are in the network. If you don't like those doctors, then maybe don't sign up for the Medicare Advantage plan. But they don't tell you that you can only see that providers within the network. So make sure that you know that so you don't have to go through that experience. Now for people that have Medi-cal and Medicare, you can have your Medicare with a health plan and you can have straight Medi-cal. And vice versa. You can have your Medi-cal with a health plan and you can have traditional Medicare. That's fine. Now if you choose to elect a health plan for each, for Medi-cal and for Medicare, also a health plan, make sure that they work together, that they're partners, because otherwise they will just disenroll you for one or the other and then you'll be asking, what's going on? I can't see this doctor, I can't see that doctor, I can't get the services, I can't get that services, because they have to work together. So make sure that, when you're signing up for any Advantage health plan or supplemental plan or with your Medicare or Medi-cal, that you ask, well, if I sign up with this Advantage health plan, can I still use my Medi-cal with this health plan? Because otherwise they'll just disenroll you. Another thing that's going on around right now that I've seen is a lot of the seniors that have Medi-cal, that have straight Medi-cal, which is not enrolled with the health plan, are getting this letter from LA County saying that by May 1st, they have to enroll their Medi-cal with a health plan. And if they don't do it, the Medi-cal will just choose for them. That's not good. So make sure that if you already got this letter or if you're going to get this letter, that you keep your eyes open for the mail for further instructions because they'll be sending you instructions on what plans and how to enroll. Otherwise, they'll choose one for you and then you'll be caught in that whole dilemma of Who do I go see? What happens? So it's better if you decide what services you want and which doctors you want to see. Now, some of the good things about, I know it sounds so bad, right? No, but some of the good things about having these two programs is that some of them provide fitness classes. Like I'm a certified personal trainer by the National Academy of Sports Medicine, and I used to work at 24 Hour Fitness in Lancaster Sports Club. I actually witnessed and saw one of the classes that they provide for Medicare participants. It's called Silver Sneakers, and it's all for seniors, and it's great. So, and that's one of the pluses to having a Medicare Advantage plan, because some of these Medicare Advantage plans, they provide these individualized classes and programs to help seniors do fit and have a great social life and have a wonderful time. So the Silver Sneakers class, if you want to find out if your plan is eligible, they offer it. I have a number here and I can give you later. But they offer at All About Fitness and 24-Hour Fitness. And basically it's an award-winning program, and they offer conditioning classes, exercise equipment, pool, sauna. The classes are designed for older adults who want to improve their strength, flexibility, balance, and endurance. So it's a really cool class. They give you like light weights, and they have chairs, and it's a lot of occupational therapy and flexibility stuff. We do some of those things at our daycare if you're interested. Another advantage to the Medicare Advantage health plan programs is they have, I know Aetna has a case management service. Well, they have a manager and a doctor help you with your needs. They also have like a weight loss program where they have an individual coach that helps you and keeps you on track if that's what you want to do, you want to lose weight. So these are just some of the advantages. They have a women's health reminder, an annual preventive reminder, and a hypertension program. So they have a lot of little perks out there with this Medicare Advantage programs to help you, if that's what you're looking for. So it's really a preference, what you like, what you need, what services you require. So you can make a decision based on that. So just make sure you do your homework and find out, what you're looking to get out of this. And if you want to keep your doctors, if you want to explore other doctors within